I think, you know, we've covered a lot in this discussion, and I'm hoping our viewers have taken something away from this. I mean, what would be to sum some of these points up?
Can I add one other thing?
Yeah, of course you can.
There's always the other breast.
Right, okay.
And not only the screening and follow-up and everything else, but actually the other breast is never going to be the same. Whichever reconstruction you do, never going to be the same as the other side. And often you have to consider whether or not you need an uplift, a reduction. It's often an opportunity for the lady to get a better shape and form on the other breast. And symmetry is really what plastic surgeons are very well capable of getting. Often it involves putting an implant in the other side just to give us a bit of fullness. Now, which implant would you then choose? Bearing in mind there are complications from augmentation on somebody that's now got a breast that was normal, you're trying to make comparable with the other side. So again, it becomes, to me, a no-brainer. You've got to use an implant. Which is the best implant? Well, it's got to be a polyurethane. So if you've got a polyurethane on one side, well, why didn't you put one in the other side when you had the opportunity? It's something which isn't been made clear to the public, the ladies, the associations, and even surgeons. It's a very macho thing to move a flap. You know, as a surgeon, it's a lovely thing to do, but you've often got to think that is that the right thing to do in all cases? And I would argue the opposite. I would say it's actually not the right thing to consider as the primary option. It's something that has a place, but it's not the panacea. And I would, you know, as a member of my family, the first thing I would say, well, let's see an implant, see how you get on. If you don't like it, then we can go for the bigger surgery.
Is there any other final points that you two would like to make?
I would like to make the point and stress the point that if you are a patient for any kind of breast surgery, whatever the situation may be, that you, first of all, most importantly, find the right surgeon and invest a lot of time and effort into fact gathering and research gathering to make sure that you find the right expert. And the second thing is, be part of the choice for which implants are going to go into your body. If that means you doing your own research by internet, by reading, by consulting other patients who have been in a similar situation, do that. And finally, when you are in front of your surgeon and the choice of breast implant is being put in front of you, ask lots of questions. Again, ask why your surgeon favours the implant that he or she presents you with, and try and find out as much as you can. And my final piece of advice is watch the space for polyurethane implants. They really are making significant developments, and I think that what we've seen so far is very promising, and we should learn more.
Great. Patrick?
I just want to reiterate basically what she was saying, which that the women should become as informed as they can, and the final decision should be between, there's a lot of implants out in the market, but the final decision should be between the physician and the woman, bearing in mind that the woman pays the price for this. It's her body. She has the implant, so she should become as informed as she can.